NBC News medical contributor Dr. Natalie Azar joins me now. Dr. Azar, October's now just weeks away. Do you think that's a realistic timeline to know if the vaccine is safe? What are your concerns?
Well, yeah, so there's two things that we're following, right? We're following safety and efficacy, Allison. And from the beginning, from phase 1 to phase 2 to phase 3, there's always the concern about safety and monitoring for any sort of safety signal to emerge. And even after a vaccine is approved and comes to market, there's post-marketing surveillance, they often call it phase 4, where they continue to monitor for safety. So can we get an idea of whether or not we can say it's reasonably safe by October? I think so, because I think we've already been able to say that with the hundreds and now thousands of people who've received the vaccine. Efficacy is another thing altogether. But keep in mind something. The phase 3 trial is enrolling tens of thousands of people, roughly 30,000. 15,000 are going to get placebo, 15,000 are going to get vaccinated. As Stephanie said in her piece, though, the benchmark that the government or CDC or FDA has set for efficacy is 50%. Well, you could take a handful of subjects and get to 50% efficacy, right? You would only theoretically need 150 cases of infection, 50 in the vaccine group and 100 in the placebo group, and you can say that your vaccine is 50% effective. The bigger issue is always what happens after longer periods of time. Is it truly, does that efficacy signal or number or whatever stay the same? Do any safety signals emerge? So as the Pfizer executive said today to Savannah, we can start to get efficacy data in the next couple of weeks or months, but the researchers are not going to be the ones who are going to analyze that. That will be an independent data safety monitoring board who's going to actually look at the research and say, yes, in fact, this is efficacious. Then they have to apply for approval, and the process takes some time. So we're not going to go from effective vaccine to shot in the arm 2 weeks later. That's not how it works.
How about the pledge from those 9 vaccine makers who say that they won't rush to get government approval? 2/3 of Americans in a recent USA Today Suffolk poll say they won't get the coronavirus vaccine when it's available. Do you think that pledge will change any of those minds, or do you think that these drug makers need to do more to convince Americans that the vaccine will be safe and that they should get it?
Well, I certainly think it's more beneficial than not that they did do that. Will it be enough to sway people who are critical or concerned? I really don't know. What's happened here is really a crisis of credibility, which in large part was the government's own doing, from the revoked EUA of hydroxychloroquine to the exaggerated efficacy of convalescent plasma to changing the CDC guidance on testing. So you really can't blame people for wondering or being skeptical about it. What I will say is that, sometimes, and I know people are also skeptical of pharma, people need to understand that the pharmaceutical companies are at risk of losing huge financially, or losing, I should say, in a significant manner, which is what the whole thing Dr. Fauci was always saying about this Operation Warp Speed. The biggest risk is really a financial one, not a scientific one, because all of the necessary scientific rigor really did happen. I've always said it was such an unfortunate name that they called it Operation Warp Speed. It gave it sort of this illusion of cutting corners and sacrificing science and safety, for speed, which is really not what happened.
Yeah, warp speed does make it sound like they're rushing to the finish line. Dr.
Exactly.
Azar, it's always great to have you on. Thanks so much for your expertise and advice. We really appreciate it.
Sure.
Allison, here in China, there's traffic again, crowds, masks not as mandatory as they used to be. All signs that things appear to be returning to normal here. Hundreds of millions of kids are now back at school, my son included. The first time since January that he's been in a classroom. Now, it doesn't mean that the virus has disappeared. There are legitimate concerns that there will be a resurgence here, but it hasn't stopped China's government from declaring victory against the pandemic.
In Beijing, the political leadership led by Xi Jinping gathered at the Great Hall of the People for an award ceremony that recognized the work of people in fighting the outbreak and epidemic here. They include Zhong Nanshan, who's sort of China's version of Dr. Anthony Fauci, who received the Medal of the Republic, as well as Chen Wei, a military medical scientist who did early research on a vaccine. The ceremony was basically a victory lap for Xi, who praised China for being one of the few countries to get the virus under control. Still, China faces international criticism for its handling of the virus, especially in the early days. And there are concerns about the upcoming flu season and that it coincides with a big holiday period when millions in China are expected to travel. In India, cases continue to rise across the country, which now has the second highest number in the world, more than 4.2 million, overtaking Brazil. The athletes' village for the Commonwealth Games has been converted to an isolation center for COVID-19 patients. Despite a surge in cases, the government is still pushing ahead with ending restrictions to get the economy moving. In Delhi, even the metro reopened. Officials are counting on the country's high recovery rate to get it through the crisis, its strategy of testing, tracing, and treatment. But if the disease continues to spread from the big cities and across the hinterland, and that's where most people live, India could soon pass the U.S. as the most affected country on the planet. In Europe, too, cases are on the rise, including Italy and Germany, so much that some countries are reimposing travel bans on people coming from high-risk areas. Spain and France have seen infections go back to levels last seen during the peak in March. And countries like Greece and Croatia, that had been spared during the first wave, are seeing a surge because tourists took summer vacations there after Europe's borders opened up in June. Experts say the rise in cases is not as fast as before, and there's better testing capacity now. So you can't really draw a direct comparison to the number of cases then and now. But the trend is worrying. So it's back to measures like closing nightclubs, mandatory masks in public, even curfews. In France, schools that reopened just days ago are closed again.
It's concerning, right? Today is the third day, so we just started and there are already cases. So we don't really know how to figure it out, to plan for this.
More temporary COVID-19 testing centers have been rolled out across France, which is reporting the highest number of new coronavirus cases per week since the pandemic began. They're testing more, so that's part of it. But it also reflects that more people were taking vacations, they're returning to offices, they were relaxing measures. 19 regions across France, including Paris, are red zones again.
Detroit, Michigan's largest school district, back open today, vowing to provide a COVID-free environment. NBC News correspondent Ellison Barber is at Marquette Elementary Middle School in Detroit. Ellison, what is Marquette and the rest of the district doing to try to keep its schools COVID-free?
Hey, Allison. Well, it took a lot for this public school district to make it to today. If you'll remember, in the summer, they decided to start in-person instruction again for summer school classes. There was massive amounts of protests, teachers, parents physically blocking school buses to try and prevent students from being taken to those classes. There was a lawsuit that then led to every student and teacher being tested who were in those summer school programs, and 3 students testing positive for COVID-19. In mid-August, the teachers union actually voted to authorize a strike related to concerns they had about safety heading back to school in September today. It seemed like there was maybe not a ton of progress on and off, a lot of different back and forth, slow-moving negotiations, if you will. And then about a week ago, the district and the teachers union said that they reached an agreement on safety precautions to move forward with the first day of school today, September 8th. Some of the agreements that they made in terms of those safety precautions are limiting the number of students to 20 per classroom. The district also agreed to provide free testing for students and teachers, any of them, if they wanted to take a test. They also agreed to do some hazard pay for teachers doing face-to-face instruction and also let teachers make the decision as to whether or not they wanted to do in-person teaching or do it virtually. The school superintendent stopped by this elementary school earlier today. And among other things, he talked about kind of what they will be watching moving forward. He says they will reassess everything in 9 weeks and get a better sense of parent demand for face-to-face instruction and also keep a really close eye on the % positive of COVID tests. Here's some more of what he had to say.
Well, one thing that we're constantly looking at is the infection rate in the city. So right now it's still at about 2%, which is acceptable for face-to-face instruction. I think if we move into 6%, 7%, we probably would not offer face-to-face. So that's one thing we'll look at in the next 9 weeks. Obviously, we'll monitor outbreaks that could happen in different schools.
And if you look back here over my shoulder, you can see actually the line of parents coming to pick up their children, their students today. You can see that they are spaced out and socially distanced. They have 2 different doors this morning. They were separating the groups. The older students at this school, 3rd grade to 5th grade, entered through one door, kindergarten to 2nd grade through another. As soon as they walked through, they were given temperature checks to make sure that they were cleared and okay to head to their class. Allison?
Ellison, I know parents there are also concerned about the quality of special education in the district. What are they telling you about that?
Yeah, I talked to one mom this morning as she was dropping off 2 of her children. She said both of them have special needs and needed to come back for in-person classes because they needed services that are only offered in person. Her daughter, for instance, she needs speech therapy. She said that she was glad that they have this option now of doing in-person instruction, but she was frustrated with some of the procedures in place at this school and around in the area, some of them necessary precautions, perhaps because of COVID-19, that had, in her view, some unintentional consequences that made the situation for her children a little bit difficult. Here's some more.
Not being able to talk to the teachers is like a big issue because now they're not going to know that he is autistic. So if he has a meltdown today, they're just going to think he's a bad kid. And with my daughter, she has a speech delay, so she can't talk well. So again, that's going to cause issues because the teacher's not really going to know how to handle her or deal with her. And the school is basically saying, like, you got to make an appointment to talk to any of the teachers.
So for her, she felt it was very important to be able to speak in person this morning with both of her children's teachers, but she wasn't able to do that because parents are not allowed inside of the building because, obviously, of the very real risk of COVID-19. She said at the very least she felt like that could have been communicated better or more solid procedures, if you will, put in place for some people like her who maybe had specific or special circumstances. But it kind of goes to show you there are many factors that parents are considering when they're trying to decide whether or not to send their children to school. And also, as school districts move forward with plans to get kids back in school, there are sometimes unintentional consequences. And in a lot of ways, all of this, everybody is still really figuring things out. And it's kind of just a wait and see what problems might pop up. And for this woman, this mom, that was a problem she had this morning. Allison?
Ellison, what a challenging time for parents, for kids, and for educators. Ellison Barber in Detroit, thank you so much.